when we talk about rock bottom, we're talking about people that are completely hopeless. And then I see within 2 weeks, come in, bright smile, hey, how you doing? Their spouse, their friend, their loved one who brought them in is like, something's going on with them. They're a different person now.
Today, I'm going to be walking with Dr. Geoff O'Neill from Ketamine Uplift, someone who's been part of my journey for the last 4 or 5 months. Only feels right that he is on as my first guest. I'm delighted to have him on. Dr. Geoff O'Neill is the founder of Ketamine Uplift and been an integral part of my journey. So without further ado, we've just grabbed coffee here at Alfred's in Marina Del Rey, and let's walk with me, brother. Dr. Geoff, nice to see you again, my friend.
Rob, it's very nice to see you, my friend.
How you doing?
I'm doing very well. I'm doing well. Yeah.
A hero. I don't call many people a hero, but you are certainly one of them.
Thank you.
Definitely have changed my life, and I, forever thankful. So I'm just really thankful that you've agreed to come on as our first guest here.
Oh,
so
think nothing of it. I'm just happy to see you. I'm happy to see your smiling face.
And this
is a great moment.
Just with any guest, what I'd like to do is just get a little bit of a history, get a feel for who's on our show. So how did you get started in medicine? How did you get to be in ketamine?
Got it. I'm the first physician in my family, but growing up, I always did really well in school. And I really didn't know what I wanted to do after high school. But my dad had his best friend's son was going into medicine at UCLA. And the conversation literally went, hey, Bob's son's going into medicine. You should do that too. And I said, okay, that sounds good. And fast forward 12 years later, I was graduating from UCLA Medical School.
That's awesome.
And then at that time, I decided to go into anesthesiology. I was really into pharmacology. I was really into operating rooms and kind of acute care. And so that's how that all started. It wasn't some amazing story. It was literally just a suggestion from my dad. But anyhow, over the last 15 years, I've been practicing anesthesia at a hospital in Santa Monica, St. John's. From there, that's where my exposure to ketamine started, using ketamine as an anesthetic. So it's probably one of the most commonly used anesthetics in the world.
Yep.
And so we use that frequently in my practice. But it wasn't until a few years ago where I really started seeing the evidence that low-dose ketamine was really affecting change in the mental health world. I had always been into IV infusions. I'd gotten into vitamin infusions prior to the pandemic, NAD infusions, just health and wellness. Mm-hmm. But then when I really started to see the evidence with ketamine and how it could affect people, I was kind of knocking out 2 birds with 1 stone with my interests. And so now I'm doing infusions. Now I'm helping people. I'm using an anesthetic drug in low doses. And now we're here. Now I have my own clinic and I'm helping dozens of people a week.
Certainly have.
Yeah.
So I guess I personally had heard of ketamine infusion therapy first off through my therapist who had recommended it quite a few months before I took it, and I dismissed the idea completely. Dismissed it because for me, I just didn't want to try another punt and it not work.
No.
My wife then suggested it when I was pretty much below rock bottom. It was, for me, as you know, we chatted on this. I was at rock bottom. How would you kind of explain ketamine therapy to everybody out there who doesn't really understand, like me?
Yes.
Just only 6 months ago, I had no clue what it was or what it did.
That's one of the first questions I get asked by just about anyone, which is ketamine. How does that work for mental health? And so the best way to describe it, the simplest way to describe it so that people can understand is ketamine is a substance, and this is not unique to just ketamine. It's unique to many other substances, drugs, things you can do. But ketamine induces a profound state of neuroplasticity, okay? And that's the key word that I like to really get into people's heads, which is neuroplasticity is your brain's ability to heal and form new thought patterns, okay? It's kind of creating an environment in your brain so that you can change the way you think, okay? Mm-hmm. So it's allowing it to be reprogrammed, okay? And so ketamine does this in a profound way. It's been studied for the last 25 years. And we know the dosing, we know how to mitigate the side effects, and we give ketamine to induce this state of neuroplasticity. With that, we now have a heightened state of just openness to new thought patterns. And as you know, mood disorders, mental health issues, it all centers around the core of the problem is just the way you think, the way you perceive things.
Yep.
Okay. And so we're attacking this at the core. We can change the way you think about things, change your perspective, change your thought patterns. That's how we can fix any and all of these issues that we have with mood. So it's really just a drug that when used appropriately, we can change your mind. Okay. That's it in its basic form.
Yeah, I think that's the key goal there is obviously it's medically supervised, used appropriately.
Yes.
You know, I think there's a big misconception of, you know, snorting ketamine to, you know, having it infused. And that was kind of like my kind of confusion on it before I started it. Now, one of the things, I wouldn't say that sold me, but one of the things for me personally that kind of, I remember yourself and your partner telling me was about the science behind it. Like, and that was the thing that got me, like the real science data, which isn't publicly out there commonly known right now,
right,
which we'll come to. But yeah, just fill me in a little bit more about the science.
Yeah, so the science, certain drugs out there, and ketamine is a synthetic drug. So it was, it's man-made. It was discovered in the 1960s. And when it was discovered, it was then and still continues to be used as a tranquilizer or an anesthetic. Okay, that's a synonymous, tranquilizer, anesthetic. And what it does is it's a unique anesthetic where it causes a dissociation between the mind and the body. Okay, so you can literally perform an operation on somebody just on high doses of ketamine because their brain and nervous system is detached from feeling anything that's going on with their body. Now, what they found, which is the latest discovery with ketamine, is that sub-anesthetic doses, low doses, causes this state of neuroplasticity that I was talking about. And it's pretty interesting how it was discovered. It was, they were actually looking for a therapy for schizophrenics. And these are psychiatrists, and they're running studies, and they started giving these schizophrenic patients low-dose ketamine infusions. Didn't help their schizophrenia, but they were noticing, hey, all these schizophrenic patients, if any of them were depressed, they're no longer depressed.
Wow.
Okay. And so that opened the floodgates into research into how is ketamine decreasing or solving the problem of depression in these people. So then you fast forward 30 years, tens of thousands of studies later, and they elucidated this cellular pathway or this cellular messaging that caused neuroplasticity. Okay, so at the cellular level, ketamine is inducing this state where these neurons are literally able to heal or grow and form these new connections. Okay, and so they postulate that's the mechanism by which we heal depression, we heal anxiety, because as I said before, all those involve negative thought patterns.
Yeah.
So if we can reprogram, retrain your brain using ketamine as a catalyst to get that neuroplasticity, but then we also combine it with, hey, this is how I want to think about things going forward. This is what I want to move past. So that guidance or those instructions combined with that neuroplasticity from the ketamine, that's how you get the results. That's how you get these dramatic, long-lasting, amazing results, these massive turnarounds in people, because we're attacking it at the core.
Yep.
Okay. Yep. So it's pretty amazing. I get excited just talking about it. You can tell.
I definitely. I can only say from my perspective what's out there, and one of the things that I've kind of come to terms with since I met you, and I've gone through this whole amazing transformation. And I'd say largely partly 60-70% because of, you know, the ketamine infusion therapy. The rest is through the intentions, the rest is becoming sober, but I think they all kind of gel together. When I came to you on my first day, I was having those cravings of addiction that have since disappeared. So
yes,
I think with that, with the help of, you know, my intentions that I've set, with the work I've already done with my therapist, the healthier life that I'm living now is, you know, it's going to set me on this path. But how would you explain the difference to any other kind of medical? I mean, I know personally, but how would you explain to somebody out there how this is different to any other medical treatments out there?
As medicine has evolved over time, our treatment strategies have changed. They've evolved. What I would say is that ketamine therapy represents just a change in the way of thinking of how to approach mental health, okay? Before it was, let's treat the symptoms. You got your SSRIs, you got all your medications that really just either cover up or treat the symptoms.
Yep.
You take a pill,
Yep.
you increase a
Like a Band-Aid.
neurotransmitter. Yeah, exactly. You block a transmitter and you hope for the best.
Yep.
Okay. And that's what's been going on for the last maybe 40 years.
Mm-hmm.
Okay. And you're sad, you take the Prozac and you take it for the rest of your life and we hope it works.
Yeah.
Okay. But with ketamine, as I explained before, with this neuroplasticity that it induces, it really is a whole focus on the cause of the depression, the anxiety,
Yep.
whatever the mood disorder is. Okay. And so when we focus on the core problem, which is, hey, I'm having ruminative thoughts on something. I have this irrational fear of something. Hey, I'm deeply saddened and I don't know why. Hey, I don't see any purpose in my life. Okay. So these are all negative thought patterns, and you can't just change them by just increasing a neurotransmitter in your brain.
Mm-hmm.
You can't just say, oh, he's low on serotonin. Let's bump that up. And then he's going to be all fine and probably great after that.
Yeah.
So this is approaching it from, hey, let's fix the way Robb thinks. And we do that by growing new thought patterns, cultivating new thought patterns, and strengthening the good thought patterns, okay, that allow you to lead a healthy life and in a clear way of thinking. So drugs like ketamine or substances like ketamine that induce that neuroplastic state, I think that's the future of mental health, okay? It may not be ketamine, in 20 years, it might be another drug they create that has no hallucinations or something, but it's going to involve being able to change the way you think, okay? I also think the focus is going to be not just on inducing that neuroplastic state, but also having custom intentions or direction for your brain to grow and have new thought patterns, okay? That's what we do with you. That's what I do with every patient, okay? If you recall, we had about an hour-long talk, maybe more, where we created the instructions. And it was something that you and I worked on together. And that was prior to your first infusion. And that's because it's not just the neuroplasticity, it's the neuroplasticity plus the custom instructions for you, okay? So I think that's going to be the new direction in mental health. Doctors, scientists, they're still trying to wrap their heads around it. Okay, it's but I think in this point in time, I've found the recipe for truly affecting change in mental health. Doing it in a way that's safe and effective and dramatically fast, as you know. Okay.
Very fast.
And so I think that's going to be the direction, and we're going to start to see that be kind of like a first line therapy over the next couple of years. Okay. It's going to be some celebrity that says that they did it, and then all of a sudden people are going to be looking into it, and then it'll be a household therapy that people will go to first.
That's
my thoughts.
I guess from my perspective, it's like I couldn't believe that I didn't do it sooner. I couldn't believe that. And one of the reasons why I wanted to start this whole podcast really with ketamine therapy was I just couldn't really find much information about it. Even after my second and third sessions, I was then going online to look for more information because from what, I didn't know what I was going to experience on my first session.
Right.
Because there's nothing really out there. Although you probably tried to explain it to me, my mind was, a little bit bonkers at the time.
A little bit. No, it's you're not in a state of like, hey, I want to learn about
probably
things.
absorbing. I was just like, this is the last throw of the dice for me, and this is something that I wouldn't encourage. And I've had people reach out to me, since then, and they've heard my story, but I certainly wouldn't ever tell people to wait until last roll of the dice as I had. I would attack it a lot sooner.
Yeah, well, your situation coming to me as at your wit's end and as like the last resort, that is probably the most common patient that I see. Okay. They've exhausted everything else. Nothing's working. I have patients say it's either this or I check myself into the hospital. Because I'm at the end here. And it's unfortunate it's that way, but my goal is to change it so that this becomes as I said, a first line therapy, something people go to at the start of their depression, at the start of their anxiety, versus, hey, I'm gonna try these pills for several months.
Mm-hmm.
I'm gonna fail on those, and then I'm gonna try this therapy, and I'm gonna fail on this, and then only at the very end will I look into ketamine therapy.
Yeah.
And it's just because it's unknown. It's still not a mainstream type therapy.
Yeah.
Okay. And then there's also the stigma that goes along with ketamine. You know, people immediately think horse tranquilizer or club drug. Okay. Yeah. And that's fair. I mean, it's been around since the 1960s.
Mm-hmm.
I mean, it's abused as a drug, and it is a tranquilizer. In my world, it's called an anesthetic. Yeah. And it's not just for horses; it's for all mammals that are walking this planet. Mm-hmm. Did you know even Navy SEALs they carry ketamine around with them in case someone's injured in battle?
Really?
And the medic and the team needs to do something, you know, set a bone or whatever it has you. They give them a shot of ketamine because it's a total anesthetic and it's a very, very safe drug. So extremely useful, but it gets that stigma. When you hear ketamine, the first thing you think of is like, oh, people on drugs like hallucinating at the club. You know? Yeah. So that's okay, but you know, it's going to change as more and more people like yourself see the benefits of it, tell their stories of it just changing their entire world for the better.
Yep.
Each time one of those stories gets out there, that stigma is just going to start to change.
Yep.
And it's going to evolve into this, hey, that's the drug that saved Dad. That's the drug that saved my sister. That's the drug that saved me. So my aim is to change it from, hey, it's tranquilizer or anesthetic, to, hey, this is an incredibly powerful tool in helping people change their life.
So obviously, without giving any personal information away, what would you say is the biggest transformations you've seen generally in people?
The biggest, I mean, they're as big as it gets. It goes from people walking in ready to end it, okay? I mean, when we talk about rock bottom, we're talking about people that are completely hopeless. The tank is on empty as far as hope. And they come in and you see it on their faces. And then I see within 2 weeks, coming in, bright smile, hey, how you doing? Their spouse, their friend, their loved one who brought them in is like, something's going on with them. They're a different person now, okay? And they say the same thing you did, which is like, I don't know why I didn't do this earlier, okay? And this is in the span of 2 weeks. I will see rock bottom, ready to end it all, to how bright is my future, and everything is great. And it's not a high, okay? I describe this as lifting you out of a fog, okay? That's been holding you back for so long. So those thoughts, those negative thoughts, depression, the anxiety, the trauma, whatever it is, we're allowing your mind to move past those thoughts. And now you're just free to create new positive thought patterns, okay? So I'm not producing a high. I'm just getting you out of that negativity, and that allows you to live your life. Probably the most common, profound comment I get from patients that have been severely depressed for decades, sometimes anxious, depressed for decades. They say, hey, doc, is this how normal people feel? I woke up today, I wasn't ruminating, I wasn't sad, and they almost don't know what to do with themselves because now they're not dwelling on all these negative thoughts, and they're honestly like, okay, what do I do now? You know, and they ask me, they're like, well, what do I do? I'm like, do whatever you want, whatever makes you happy. Now you're free, you know? And so it's that lifting out of the fog, and where I see that just dramatic change. But that's the comment that makes me smile the most. They're like, is this what normal people feel like? Because these poor people haven't been normal for so long. I mean, you remember. And when you haven't been normal for so long, you forget how to actually live your life. And so it's unlocking all these doors for these people to get back into their normal life and to pursue the things that make them happy. So, you know, the most dramatic change, I think they're all dramatic. Okay. But that comment that I get from most patients, that to me, that's a sign. It puts a big grin on my face every time I see it. Cause I'm like, yep, there it is. That's the change. That's the transformation. And this is in 2 weeks, 3 weeks. I mean, for you is probably within the first week.
Yeah. Well, it kind of brings me on to a next question.
Yeah.
So I mean, it's been a minute since we seen. I think I saw you a couple of months ago. But what would you say, like, from obviously you saw what I was like on on the first visit there to how I am now. Like, and I've asked this to a couple of people, so I'm not putting you on the spot.
No.
You know, my wife, she deems it as this big black cloud has kind of lifted above me. I've had other people kind of mention to me, you know, you just seem a bit lighter, Rob. You got a bit more pep in yourself. What would you say, like, you've seen a change in me over there?
Yeah, you know, when I first talked to you and then saw you in person, you know, it was a lot of looking down. It was not sullen, but just muted, and you look tired. And you look like you were carrying the weight of the world. And it looked like this frustration, like, I have no reason to be so sad right now, but I am, and I can't stand it. Okay. And then now it's every time I see you, there's that shit-eating grin that that's amazing, you know? And you know, but more than just a patient, you just become a friend that I like talking to, and this is your true self. This is who you are now, or this is who you always were, but you were just being weighted down.
Yeah, definitely. I'm seeing that body. I mean, I definitely, you know, we always say the words normal. You know, what is normal? But I just knew, like, every day I shouldn't be feeling like that. You know, I knew that, you know, again, there's no such thing as normal, you know, in everybody has their issues, but just to get out of bed every day. And I think there was so much self-loathe there. There was so much hatred towards myself, and I couldn't quite understand why, and I was abusing my body. But then I had this wonderful family. I had these 2 kids. You know, I've had no dramatic trauma throughout my life, you know, compared to some people. So again, that was more guilt, but I felt like, I definitely felt after the first session, there was a shift. And I remember you saying to me, I think, did you have any epiphanies? And I had it in the first session. I didn't know I was going to be basically going to a medically induced trip. I just thought it was going to be like an NAD, kind of like sit there with an IV, watch an iPad. And I kind of went into it blind, but I'm thankful as I did, because maybe if I'd researched it a bit more, you know, I'm kind of very thankful that I went into it and just trusting you and trusting the process. And like I said, I went all in, I think at that time. So, like, I'm forever grateful for you, for sure, and what you've done for me and my family. And I know you've helped, you know, hundreds of others as well. So it's just interesting to see, you know, when I've got thick skin now. So, like, you know, even doing like this podcast and talking out in public, and I really don't give a shit what people think about me anymore. And it's the great thing of life. When you get to that point in life when you really don't give a shit what people think, and it just gives you this whole new life. Because as long as I'm good in myself, because I've thought, you know, all those names I've called myself. So there's nothing anybody can say or do to me that will change. So with that then, like, everything obviously we've gone through there, what would you say is like the misconceptions that you hear on a daily, like misconceptions of ketamine therapy? Like, what are the things that that's not true? I mean, we've talked about the recreational drug, the tranquilizer, but what else would you say?
Yeah, well, it kind of touches on the recreational drugs or drugs of abuse. And probably the biggest misconception is that, we're just getting you addicted to ketamine.
Yeah.
And that's how we get you out of the depression or anxieties. We'll just get you addicted to ketamine, you know, and you'll enjoy that, and you're just going to want to keep coming in for that. And so that's completely, it's exactly opposite, actually. So, as opposed to traditional antidepressants, anxiety medicine, highly addictive, or you're just required to take them for the rest of your life. Take 1 pill a day, rest of your life. As I said before, ketamine is very much inducing a state where your brain will listen, or it can heal, or form these new positive thought patterns. But then once we get those, that just becomes your default way of thinking. And when it's your default way of thinking, you no longer need the ketamine. So you need the ketamine less and less, because we've already used its neuroplastic effect, and now you've changed. Just like you right now. I haven't seen you in, 6 months, and you're still thinking the same way, because we've essentially reprogrammed or retrained your brain to move past all those negative thoughts. Okay. And so that's probably the most common misconception, is just we're just getting you addicted to another recreational drug, getting you high. When the reality is all I care about is changing the way you think, and then you're done with ketamine, hopefully forever. So that is the common misconception. Another one is that, oh, you're going to get me in there. I'm going to freak out. I can't handle something like that. I can't handle, like, I see what those kids at the club are doing on ketamine. There's no way I want to go in. The doses that we give to induce this neuroplasticity, way lower than what you would even do in the club, okay, for recreation purposes. And so this is sub-anesthetic doses, so much lower than I would give even a baby for anesthesia. This is much lower than what somebody would actually do in a club. And so now we're even below that. And so there is some feelings of dissociation, of loss of oneself, okay, for a short time. And we're able to mitigate those side effects if that scares people off. But I think it's a very small side effect to deal with when we consider how dramatic the changes are and what we're trying to actually solve here, okay? Which is we're trying to save people's lives here, okay? These are crippling disorders that people are walking around us at all times of the day, and we have no idea. But this is what's going on in their head, and this is just a very powerful treatment to dramatically change them quickly.
So where do you personally see ketamine therapy heading in the next 5 years? What do you see as its future now?
Well, as you've probably seen, there's many different ways to use ketamine for mental health. They'll even ship it to your home, through some of these practices. So ketamine can be taken sublingual, oral. It can be nasal spray, injected in your muscle, or infusion like we do. So I see it already expanding to the point where, people are looking into it because there's so many different ways that you can use ketamine to your advantage. I think I see ketamine evolving to where there's probably going to be a little bit more regulation on it, where they're looking into it and saying, okay, what are the safe ways to do this under physician supervision? But I think the direction is going to be not just getting the ketamine, it's going to be the ketamine plus the instructions that we talked about. Okay. If you're just taking ketamine, even at sub-anesthetic doses that we do in our clinic, you can lift yourself out of depression, but I think the rates of the cure rates are going to be much, much lower without those intentions.
The whole purpose of creating this video and meeting you today was to kind of introduce, not only from my side of the story, but so can you explain what people experience? What's the general kind of conception of what you experience during that hour and a half that they'll spend with you?
So ketamine is a dissociative anesthetic, okay? That's what it's classified as. And when I say dissociation, it's literally a dissociation between the mind and the body, okay? So the most common description is this loss of oneself. So it's like you feel, I am no longer Dr. O'Neill. I am now one with the universe. And oftentimes you can see yourself there. You're like, I'm not that person anymore. I am part of everything. Okay. That's that loss of oneself. So that's the dissociation that people talk about. There are also, people talk about this feeling of motion. Sometimes it comes in waves. That's a more typical description I hear from patients. And sometimes these waves of zooming around in the universe or floating in and out with the ocean. Those are some of the common themes I get from patients. But I mean, what about you? I mean, you experienced it. What did you feel?
Yeah, I would say every session was definitely a little bit different. There was some kind of the bad trips in there, but I think generally, I definitely felt a lot of movement. Sometimes I was on this, I always class it as like a roller coaster, just a feeling of going high and slow and then fast. There was a lot of imagery of other people associated to my family, my kids, my wife, my brother, my dad, my mother, it's very close family, my brother-in-law. I would think about them, see them. There was areas there where I felt like I was being buried on layer and layer, then I'd come out of it, different colors, obviously. Definitely, disassociation is definitely probably the best word, because you are not at one. You're there, but you're not there. You have really no control. I think there was a couple of times there where I tried to control where I was going, and I got a lot of pushback.
Yeah.
And I was like, no, I want to stay there. There was one that sticks out the most was, I was a bird. Half of me was a bird. I couldn't see my side, but I looked this side and I could see my wife's head, and she was half a bird too, and we were both flapping. And then I was flapping, she stopped flapping, and I went this way, and I was like, no, keep flapping. And I went this way, and I could see her disappear, and I'm like, is that a message? Does that mean she's leaving me? And I'm like, so then your mind starts to work overload. So yeah, there was a lot of, and it sounds scary, but there's also a lot of peace during that trip. You know, you kind of come out of that and you feel like, wow, you know, the universe is so big. It's so beautiful. You know, I started to look at things a little bit differently outside. The colors definitely felt like I was one, like, you know, part cell of, you know, an ocean. And I was just going with the wave. It was very peaceful, very beautiful. But yeah, every trip was a little bit different.
Yeah. And that's one of the things I tell every patient as well is, well, two of those things. Every experience, every infusion is going to be completely different from the others. Okay. And so I tell them, like, try not to figure out or game the system and be like, oh, this is what it's going to be like, because you will always be wrong. The other thing I tell patients too is it's important during these infusions to just let go.
Yep.
Okay. The more you try and direct your thoughts, because the mind is doing whatever it wants to do.
Yeah.
Okay. While you're having the infusion. So I tell patients that all the time. And then I also tell them what you experience and what you see, you don't need to make sense of it. Okay. Just like so many dreams you have at night, like, you know, dream analysis, some of those things might make sense, but the vast majority of what you experience, what you hallucinate on ketamine, it's just going to be like garbage or just weird things. Okay. That's another most common description of it. That was weird. Okay. Yeah. And then you can't describe it. You're like, I tried to write it down in a journal and it just didn't make any sense. So I scrapped that idea. What's important is that we've set the intentions prior. The hallucinations, the dissociative feeling that you get, that's my only clinical signal that you've achieved this state of neuroplasticity. Okay. So I titrate, and titration in medicine or in anesthesia basically means you start off at a low dose and you just slowly increase it and you look for that effect in the patient. Okay. And so for you, I would come back every couple of minutes and say, how are we doing, Rob? How you feeling? And you'd be like, I feel a little tingly, nothing much. Okay. We'll increase the dose slightly. Come back again. I'm starting to feel like I'm floating a little bit. Increase the dose a little bit more. Okay. I feel like I'm zooming. Okay. We'll keep it at this dose. And if I go in there and I say, hey, how you feeling? I'm flying. It's a little bit concerning. Then I can lower the dose, okay? Because I want to get you to that state, but I don't want to scare you, okay? And that is what I'm going for each time with each patient. So it's very customized, okay? It's never a one-size-fits-all dosing, and it's a never one-size-fits-all experience. But the fact that we get the intentions correct prior, I get you to that dissociative state without going overboard, that's the combination. That's the winning combination in my mind. And so that's what we strive to do with each infusion, every patient.
What would you say from all of your work that you've done here now, like, has taught you with resilience and healing? What would you say, like, your...
So, yeah, my thoughts would be, I mean, you're a perfect example. I think humans are incredibly resilient. Like, we're built for abuse. But from a mental health standpoint, I think it's those people who have hit rock bottom, but still have this thirst to live and go on. They have some purpose. They have resilience, that seek help and look for ways. Those are the people that survive. Okay. And those are the people that can thrive. You know, you asked me before, what message would you give somebody rock bottom? What I would say is there's help out there, but you have to seek it. Okay. You can't, if you sit there and you just wallow in the sadness or the anxiety, you're likely going to be there forever, and it's going to be a grim outcome.
Yeah.
But people like you who said, you know what, I'm tired of this. I'm gonna find something, and there's answers out there. You found your answer. I'm just one type of answer. Okay. I think it's very effective, but another answer could be, a different form of therapy or a different drug. But the important piece is you kept seeking a fix for yourself. Okay. And that's what I've learned is it's the people that continue to push and find something. And sometimes they're helped out by a family member. But when they come to me and they say, hey, like, I need help. Something needs to happen here. And they're not embarrassed or they're not, to seek help. I think those are the people that are the most resilient. And those are the people I admire. And I can't wait to help more. Finally, then, what would your message be to someone who is like myself, maybe was at rock bottom? What's the message that you would give to somebody? The message would be, there is a better way, but you need to take action. You need to seek help. Okay. Whether it be seek help with me, seek help with just anyone, you got to seek help. But that requires action. And another thing I would want to tell them first off, though, is that they're not alone. Okay. Oftentimes, when you're in that state of rock bottom, I got nothing left. Yeah. It's a very lonely place, is it not? Yeah. So you've experienced that firsthand. So the first message would be, you're not alone. I think the statistics nowadays is something like 30% of adults in the U.S. will at some point in their lives experience a major depression. Okay. And to me, I equate that with a rock bottom type feeling. It's 30%. That's a third of people almost. Okay. That's huge. So you're definitely not alone, but the only way you're getting out of this is if you seek help. Okay. And I don't care who you seek help from, but you got to seek help. That's your only chance at getting out of it. Yeah. So that's the message I would send. And that's the message I've learned after seeing so many like yourself that come to me rock bottom, but looking for help. And it's just an amazing thing to watch the transformation, just like you have. See that shit-eating grin. Yeah, definitely, man. Just again, want to thank you for being my first guest on today. I couldn't think of any, there's no one, no celebrity, no one I would rather have as my kind of, first guest on this, because I just think this is the foundation of everything that I'm trying to do. As you know, like now my passion, my calling, my purpose is definitely, I want to help others. I want to help others who maybe don't have a voice, who can't afford it, so Walk With Me Brother, we are now, officially actually a non-profit. Mm-hmm. We've got all the documentation. As you know, next year I will be leaving LA and heading to New York, which will take me around 75 days. It's a run walk, so I'm busy training for it right now. But my goal of this is, initially it was just like, I'll do something crazy just to kind of get heads up, and you can post about it. I know June we go through Men's Mental Health Month and things like this, but I'm like, what can I do? So I guess my first calling was to get people's attention. And then I'm thinking, well, no, I don't want to just get people's attention. I want to make a change. So, my purpose is that one of the things that you said there is, you've got to seek help. Unfortunately for some people out there, they probably don't feel that they can. One of my fights is the affordability of mental health in America. Absolutely. So what I'm hoping to provide through Walk With Me Brother would be, services to those who don't have a voice, can't afford it. And we are hopefully building somewhat of a community there, community of people, brothers, sons, friends, obviously doctors, therapists, people like yourself, where we come together and we save lives. And that's, I was saved, so it's only purpose that I pay that on. So again, thank you for Dr. Geoff O'Neill for joining me in today's episode. So if this episode today has helped you, please share this, please follow us. Every week, we're going to be interviewing a different guest from, all walks of mental health's lives, people who have experienced mental health, leaders, speakers, doctors, professionals like Dr. Geoff O'Neill today. Please save this video, share it with a brother, and keep following us for more episodes as they come out weekly.